Hello, friends. This is Jovi, IELTS trainer and an OET trainer for the past 15 years. So, we run an institute in Irinjalakuda, and basically, we are going to learn what is OET and what are the issues involved in OET. Okay, so when you go through this, there are maybe a lot of doubts. You might have appeared for the exam and might have lost all the way, but there is a remedy for that. If you understand OET in a better way, you are going to grasp it from the grassroots level. Problem arises when we don't understand OET and there are confusions within us. We feel that we are from medical field and we are very much apt to that field and we can easily cover up OET. But sorry to say that you will have issues when you are trying to understand OET. So first, in this first video of ours, we'll be covering an OET overview. So let us just start with the video. And what are we going to learn in this? Here we are going to learn about the how and what each subtest looks like. We are going to learn about the facts that are involved in OET, what you have to do specifically in OET is another thing that we are going to learn. So you're going to learn a lot of things in this video. Be there for half an hour and don't miss the chance to understand OET in a better way. Okay. So OET has different subtests. OET is not specified to one test, but it makes you a complete package of an English communicator. Sometimes we are not able to understand why is this concept introduced, but we need to understand that you should be acquainted with this language and you have to undergo a rigorous practice to overcome this OET test. So there are 4 tests. That's first is listening, second reading, third that is writing, and the fourth is speaking. So listening has 3 subtests: part A, part B, and part C. Reading the same way has part A, part B, and part C. Writing and speaking will cover that when we cover that section wise. Okay, so we shall move to the next slide. Listening here is approximately a 45-minute task. A 45-minute task. What happens is usually when we listen, our focus is somewhere else and we tend to understand with the focus that is not there, and then we try to listen part of it and we try to listen only a half of it, and then we try to assume the answers, and that's a tough task. So listening covers, it is listening that's approximately 45 minutes. It's for all health professionals. So here basically you understand health related spoken materials such as patient consultations and lectures. So when we segregate that into sections or subtests, we'll understand that more in a better way. Okay, so it is basically health related, but don't mistake yourself. It is not just health related, it is related to your language. The way you communicate matters. Okay, this the listening part A overview. Let us go in depth with the listening part A. Okay, what is exactly listening part A? In part A, you have two different consultations in each, which a healthcare professional is talking to a patient, like a nurse talking, if you're a nurse talking to a patient, or a doctor talking to a patient. There are 12 gaps for each consultation. So this consultation, you have to fill in what they have said. So your ears should be sharp enough to assume and understand, not assume exactly, but to understand each and every word that they are speaking. So part A lasts for around 10 minutes. So it allows you to understand and grasp specific information about patients. So that is about part A of listening. So this is how the test paper looks like. The part A, you see this, it is a set of blanks that you are seeing this on the screen, where a patient raises hands, talks about his back injury. So there are a lot of things that have developed over the years. So you have to understand these things, and according to what conversation they are saying, you have to fill in the gaps. Okay, so in the computer test, it is something like this, and you have to just fill up the blanks. Okay, and it's somewhere approximately the same as that of pen and paper test. Okay, so here you see there are two parts to part A, 6 questions each for each part, and there are conversations that are inside the listening test. So the answer is coming from the patient. So whatever the patient is saying, you have to write that in the blanks wherever required. Okay, now we have the listening part B. So as I said, there are 3 sections to listening. Okay, so in listening part B, you hear 6 different extracts from the workplace. In each extract, you hear healthcare professionals either talking to each other, a nurse talking to a nurse, a doctor talking to a doctor, or a nurse talking to a patient. So here you see there is one multiple choice question to answer about each extract. So you have 3 options, and then you have to select the one that best suits according to the listening. So this part lasts around 10 minutes and tests your ability to understand everyday workplace interaction. Again, don't feel confident enough, because you are going to listen to a workplace interaction, but there are certain words and there are certain pronunciations that you may understand or may not understand. So you need to be very specific with that. Okay. So next is listening part B. You see the pen and paper way. You see that there are 3 options to it. The 3 options specifically tell you about how you need to answer it. Yeah, and this is how the computer based listening paper part B looks like. Listening part B, there are 6 questions, and In 6 questions, you have short monologues. Monologues means a person speaking not to someone but a direct. There is no audience as such, but there are conveying some information. And dialogues are specifically you have to figure out between two people. So there are 3 answer options. Listen for different functions because related to their jobs, their day-to-day life, related to what is going on in the day-to-day life of a nurse or a patient. So these things you will have to encounter in listening. So let's get to listening part C, the third and the most important, as I say. Listening part A is comparatively easier, but B and C is a tough nut to crack. So let us understand this very well. Yeah, in part C you'll hear 2 longer recordings. So there are chances that you might miss certain words when you're hearing longer recordings rather than shorter dialogues or monologues. So here it is a tough task. As I said, it is the hardest nut to crack. So this is the listening part C. Yeah. Each recording either an interview or a workplace presentation on a topic related to healthcare. So there are 6 multiple choice questions. The part lasts for around 15 minutes and test your ability to understand speaker's idea and experiences related to the topic. So there you are understand that speaker may be saying about some ideas or experiences. So you have to assess what he speaks. So be very attentive. Whatever word is spoken and is counter-attacking with the words in the paper, make sure that you listen that very properly within double inverted commas. Okay. Now this is the part C paper, which is a more or less like pen and paper, and which is very similar to the computer test. So you have to select the 3 options that you can. Okay, so here part C specifically facts you're getting into. It shows about long lectures. You have to listen for long. Again, an interview, maybe 2 people talking, 6 questions each, 12 total, and 3 options. It seems easy that you have 3 options and you need to select one, but it is confusing. So need to have a lot of practice when you are listening to those sections. And now comes you have this section where you are listening. Before each recording, you hear information about the context and instruction about what you have to do. Every time there is a monologue or a person speaking or an instructor speaking in the recording about what is going to be spoken. So be prepared along with that. This is what I'm going to hear. This is what I'm going to hear about the doctor speaking to a patient or a nurse conversing with another nurse or a co-staff. So be very sure that whatever dialect in listening is spoken, you have to be very attentive, especially the part where you are going to cover, where the instructor in the recording is going to specify what is going to be spoken. Now you have the reading section. The reading section is for 60 minutes. Reading section, I tell you, if you don't have the habit of reading, there may be problems that you will face, because my interpretation and the writer's interpretation is entirely different. I may understand one thing and the writer may try to deliver something else. So you have a conflict of thought. So make sure that you have a reading habit when you are starting to prepare for OET reading test. Here, part A, there are 3 parts to it. There's part A. Part A of the reading test contains 4 texts on the about the healthcare professional might use in the course of their work. You will have 15 minutes to answer 20 questions, which cover a variety of questions about the information in the 4 texts. I tell you, if you happen to attempt part A is supposed to be the easiest part. If you are well versed with reading and you are well practiced with reading, part A is comparatively very easier, and it is the easiest of the lot in the reading section. We move on. This is how the part A looks like. There are a set of questions and there are blanks that needs to be filled, and this is how the computer based part A looks like. So I hope you have understood it. So there are 4 texts, A, B, C and D, for a single topic. So you have to match questions, you have to answer short answer questions, you have to gap fill the answers, and that's what you have is 15 minutes to answer 20 questions. So make sure that you are just following the way, okay, and you are just right on track, because 15 minutes and 20 questions, you have to be a fast reader. You have to maintain, you should inculcate the habit of fast reading. Now, there's another thing I would like to tell you. If you wish to get updates about OET, I would request you to subscribe this channel, because this is going to help you a lot in your preparation all throughout. Okay, so it's not just for OET. You'll have grammar sections, you will have the base building, you will have speaking formulations, you will have a wide variety where you will enhance your language. Okay, so ask your friends also to subscribe to this. Okay, now reading part B. Reading part B contains 6 extracts for workplace communication in a healthcare setting. A healthcare setting exactly means maybe a clinic, maybe a home care clinic, or where there is lot of where health professionals are involved. So you will have 10 minutes, roughly 10 minutes. So I would suggest that you spend roughly 10 minutes to encounter this reading part B. Now this is how the part B looks like. You have, and now you see the computer version of the reading part B. Now here you have 6 questions, you have 3 answer options, short work-based text. It is comparatively way shorter, and different reading functions. You will see a lot of functions involved. So make sure that you are focusing on this and you are going in depth. Okay, so now comes reading part C. As I said, reading parts, as in listening, reading part C is the most toughest of lot, and I would request you to have ample of practice before you start going to attempt the part C or the reading. Specifically, if you don't have the habit of reading, make sure that you inculcate the habit of reading. Anything, not just OET mock test, but I would request that you have the habit of reading newspapers at least. Okay. Part C. Now part C of reading, you see 2 long passages providing information on different healthcare topics with each question each. You roughly have 35 minutes on this section. So you see, you have 35 minutes, you have 8 questions each, that's around 16 questions, and you have to You have make sure that you're getting into the depth. So with 8 questions each, you have to be very sure that you are getting into the detailed part. You make sure that you are very much accustomed to it. You have the habit of reading. So part C, I tell you, long questions, long passages, and you have some questions that are only extracted from a particular place. So then make sure that you are able to pinpoint the answer and then write it. Okay. Now comes part C paper. This is how the part C looks like, and this is the computer version of the part C. So you have 2 long questions, long text. I say that's long text means long passages, paragraphs, whatever you would like to say, and you have 8 questions for text and 4 answer options. You have now a 4 answer option. It's going to become more confusing. You have 4 answer options. So you have 4 answer options like this. So you have 4 options. So it's going to be more or less similar, but you have to find the right answer out of it. Okay. Now you have 45 minutes specific to profession. So specific to profession based on typical workplace situation. The task is the writing section, that is for 45 minutes. The 45 minutes, how will you encounter? It is specific to your profession. It is specific to your nursing job. It is specific to your practicing medicine. You specific your job. Radiographer. And then it is specific to your job. You are into pharmacy. It is specific to your job. You are a dietitian. It is specific to your job. So it is specific to your job. Writings are specific to healthcare professionals. And writing overview, you have not like IELTS, but you can write around 180 to 220 or roughly 240. The idea behind writing is to check how you write, how you put forth your ideas, how well your words are linked, and how well it is structured. All this matter. So writing, if you don't have the depth in your speaking, your writing will falter. If you don't have the reading habit, your writing will falter. It is not something we can write. You have to have the apt answer for the writing. So again, if you don't have the depth, try not attempting the exam on the first chance. Do a bit of practice and then proceed. Okay. Writing part, this is how the writing paper, question paper looks like. This is how the computer based paper looks like. So 5 minutes reading time, and you have 40 minutes to write down the paper. So if you are into medicine, you are practicing medicine, and you are a nurse, you have letters like referral, discharge, or transfer. So this is what you have to you are going to opt for. So this is what is all about writing. Speaking is a tough task. OET, people feel that it is easier, but if you don't have specific creativity in speaking, I am not talking that you be a great master, you are a great orator, but you should be able to express your ideas. You need to be able to speak for continuous hours. Then only the ideas your ideas would flourish. So the speaking is specifically for people who are able to speak well. And if you are an introvert, start practicing with your friends, with your co-staff, with your husband, with your wife. Make sure that you're practicing more often. Start speaking in English. Okay. So it is basically, it's in a private room. There are role plays, and the role play is an actor. He is not the examiner, and it is called interlocutor, and you play the part of healthcare professional. Interlocutor either plays a part of a relative, a carer, a patient, or a client, and you play the part of healthcare professional in different settings. So you have to basically sometimes empathize. You have to tell the procedure of what is going to happen, or sometimes you have to clear their doubts. So definitely speaking is all about that. And speaking overview, you have approximately 20 minutes. It's a face-to-face examination. So one thing, as we are going to end this video of ours, do not be afraid to speak. Don't be nervous. Maintain an eye contact and be soothing in your voice, so that whomsoever you are talking to is able to get the same vibe as you are experiencing, rather than being more nervous when they face you. Okay, so make sure that you are more in a comfort zone, and then you speak up with the knowledge that you have about that role play card. Okay, and this is how the role play card looks like, and this is how the computer based speaking looks like, and you're going to talk in Zoom, and where you are going to talk to an interlocutor. So there are 2 role plays of 5 minutes each. You will have 2 to 3 minutes to prepare. So 2 to 3 minutes is very crucial, where you are going to form questions that are related to their settings, the background study, and that's we are going to learn in the future videos. So I would like to suggest you to follow us, to subscribe us, or to click the bell icon. Don't forget that this is going to be very crucial in this condition. And if you have liked the video, do share it with your friends who are very much afraid of going and writing it again. We are always there to help you out. Make sure, give us always we are there to help you out. If you have a doubt, just register us. We'll sort your queries as fast as possible. Thank you. Till then, next video. Bye. See you.